Hi, this is Dr. Mamta Dighe, Director of Xenith Advanced Fertility Center in Pune. Today we are going to discuss about a topic which is a revolutionary idea in infertility and for women who want to probably postpone childbearing, and that is oocyte or egg freezing. Now, what is oocyte or egg freezing and why do we need it? We are all seeing that women are postponing childbearing nowadays. It is due to higher education, career prospects, or something as simple as not finding the right life partner. Unfortunately, the time that all this is going on also coincides with the most optimal time for conceiving or planning a childbirth. Now, why is this? This is because a woman is born with a set number of oocytes. At birth, she has about 4 million oocytes, about 2 million oocytes, and over a period of time, as she starts from the time that she starts menstruating and even earlier than that, until the time that she has menopause, she utilizes all her oocytes from this pool or this reserve of oocytes that she is born with. Hence, we cannot add to this number of oocytes that the woman has at the current point in time. Therefore, as a woman ages, the number of eggs in her ovary keeps on declining. We all know that pregnancy and childbirth is associated with age and the ovarian reserve, which means the number of oocytes in the ovary for any given woman at a given point in time. If at a point in time that you are at the most optimal time of conceiving, you do not really want to plan a pregnancy, and by the time you decide to do that, you have come to a point where the number of oocytes in your ovary are very less in quantity, and also because of the increased age, there is a problem even with the quality of these oocytes. With decreasing oocyte competence, the chances of conception is definitely going to decrease. Is there a possibility of dissociating these two? Is it that as of today we have to compromise on one for the other? Or do we have a possibility to have both these? Now we have a revolutionary idea called the oocyte or egg freezing, a procedure. It's not an idea anymore. It's a procedure which is very prevalent, which is done in all the IVF centers, that we can do something called the oocyte or egg freezing. Now, what is this? Even at a point in time that a woman does not want to have a child, she can go ahead and freeze her eggs. This is done through the IVF technology. A woman has to go through an ovarian stimulation, that is, she has to take drugs in order to make more oocytes, more eggs from the ovary. This entails taking some injections. These are hormonal injections which are given from the second day of the menstrual cycle for about the next 8 to 12 days, on an average 10 days. During this process, multiple oocytes are formed in the ovary. These oocytes, when they become mature, then by a procedure of the oocyte retrieval, which is done under anesthesia, it's a small procedure, these oocytes are retrieved out of the body by a transvaginal sonography and with a guide wherein a needle is inserted and the oocytes are taken out. These oocytes are then given to the IVF laboratory. The embryologist tries and finds out how many mature oocytes we have. And once you have these mature oocytes, and sometimes even the immature oocytes can be frozen, but mainly it is the mature oocytes which are frozen. So the embryologist identifies which are the mature oocytes, and then these oocytes are frozen. This is by a process called vitrification or flash freezing, wherein we use some media in order to cool these oocytes and then store them in liquid nitrogen at a temperature of minus 196. Once these oocytes are frozen, they are frozen in time, and they can be then stored in the liquid nitrogen cans. Whenever a woman later desires to plan her childbearing, we can utilize these oocytes which have been frozen maybe 2, 3, 4, 5 years back, and then get these oocytes. These oocytes then have to be taken outside of the liquid nitrogen. They have to be brought back to the room temperature, and then the husband's semen is used in order to fertilize these oocytes. Embryos are formed, and these embryos are put back into the uterus of the woman whenever she plans for a pregnancy. With this kind of a technique, today we can preserve our fertility and can delay childbearing at till a point in time that we feel we are ready for it. It is not that I am trying to say or propagate that you can always postpone your pregnancy. But if there are indications where for some reason or the other you definitely have to do something like that, then this is something that every woman should be aware of, because having your own biological child is an innate need of every species and definitely of all humans. And therefore, if you have a technique whereby you can make sure that you can preserve your own oocytes for use at a later point in time, this technique is something that you should always be aware of and look for. I hope that this is useful to everybody watching this. You try and get into the idea of what is available, what science is letting us do today, and then utilize it if need be. Thank you so much for being with us, and I do hope that you visit our website, share this video and leave your comments. Thank you.